Starting off our list at number 10 is Michael Jackson. He was one of the greatest performers to walk the earth, and his personal life captured the interest of millions, mostly for his change of his look.
I think I would put him much higher than number 10.
He started out as a young singer in the band Jackson 5, where he rocked a black afro and dark skin. One of the most obvious parts of his transformation was the change in his skin color.
Michael Jackson revealed that he had the skin condition vitiligo, and this was actually confirmed if you look at his autopsy reports. Now, vitiligo is an autoimmune condition where your body essentially attacks the pigment of your skin. And people with vitiligo end up having patches where they're missing pigment from their skin. Now, if you've ever seen somebody who's African American who has vitiligo, they don't typically look like Michael. They have patches where they have lost pigment, but the rest of their skin is their normal skin color. In Michael's situation, his entire skin obviously was much lighter than it used to be. And some of this could be due to the vitiligo, some of it could be due to makeup that's trying to even that skin out from the vitiligo, but it's also possible that he was using skin lightening treatments. This can come in the form of creams like hydroquinone or even IV treatments like glutathione. Glutathione is an antioxidant that is often injected IV into people who want to lighten their skin.
Throughout his career, he had multiple surgeries done to his face, including facelifts, nose jobs, chin implant, and lip tattooing to make them appear thinner.
Well, we all know that Michael has had multiple nose jobs. Now, a lot of people wonder, how many nose jobs do you need for your nose to start looking really unnatural? Well, there are a lot of other celebrities who have noses that, to me, are pretty obvious that they've undergone many surgeries. His sisters are an obvious example of this. So my answer to that question is probably 3 or more. It's not uncommon for somebody who has a nose job to have a little revision afterwards, and usually with a revision like that, the nose typically looks a little bit better. But when you start undergoing a 3rd, a 4th, a 5th nose job, every time your nose heals from surgery, it deposits scar tissue, and that scar tissue can build up more and more over time. And this is what I think happened to Michael's nose.
At number 9 is Farrah Abraham. She was cast on MTV show 16 and Pregnant when she was just 16 years old. In 2010, she had her first big surgery done, which was breast implants.
So Farrah's undergone quite a transformation over the last 10 to, I think, maybe 14 years. Her first operation, the breast augmentation, I thought was very well done. She looked fantastic afterwards. And then she started undergoing more operations.
In 2012, she got a rhinoplasty and chin implant, which reports say cost her $16,000.
These 2 operations also, I thought, were tastefully and well done, and they were actually done by somebody you and I probably know, Dr. Miami, Dr. Michael Salzhauer. And I think Dr. Salzhauer did a great job on her nose and her chin, although reportedly, Farrah said later on that she wasn't so happy with the appearance of her chin as time went on. Although the surgery was performed very well, maybe she just changed her mind in how she wanted to look.
The following year, in 2013, she got her second breast implant surgery and was showing off her new D cups.
To each their own. Everybody wants a different size when they're looking at breast implants, and in her situation, she obviously upsized to a much larger size for her tiny frame. Now, this is something that I do occasionally for my patients when they want to go larger with their implants. We can do that in a usually pretty simple operation. But I always caution them when you go really big like what Farrah's had done, because the bigger the breasts, the heavier they are, and the higher risk that they can droop prematurely, that they can cause back, neck, and shoulder pain, and they can limit potentially the activities that you are doing.
In 2015, the star went to get more permanent lip fillers, but she had an allergic reaction. She posted the pictures and captioned it, "Girlfriends, don't say I didn't warn ya."
This photo is pretty alarming when you see her big lip there. Now, this is probably not actually due to the injection itself. Unless she was having some foreign substance injected that's not FDA approved, the injectables that we use, hyaluronic acid-based injectables like Restylane and Juvederm, almost never cause an allergic reaction like this. This is most likely due not to the actual filler, but maybe to the numbing cream that was applied to her lips prior to having this done. And the treatment for something like that would be to give her a dose of steroids. When it's this severe, taking a steroid pill probably isn't enough. They probably want to give it either IV or into her actual muscle as a shot.
Since then, she has had countless procedures done. Her breasts again, her lips again, other face injections, and bum implants and bum fillers.
So she had butt implants and she had butt fillers because apparently the implants didn't give her enough size. So why doesn't Farrah undergo a BBL? Well, the reason why is because she's so thin there's not enough fat to harvest to inject into her butt in a BBL operation. Remember, a BBL, the Brazilian butt lift, is injecting fat into the butt, but that fat must be taken from a different area like the hips or the thighs. And as you can see in those photos of Farrah, there's no fat to harvest from her.
Taking over spot number 8 is Cher. The actress and singer is a legend for her talent, but also for her looks. The best part is, she has no problem admitting it. She flaunts the work she's had done with pride and says that she hopes to smash the stigma that cosmetic surgery is something to be ashamed of.
Okay, this one I definitely disagree with, okay? Number 10, Michael Jackson should be much higher on the list, not number 10. Cher should not be on this list at all, okay? Cher is nearing 80 or something right now? And she still looks fantastic. And obviously she's had a lot of work done, but like let's say Dolly Parton, she still looks good. I mean, she's iconic, she's Cher. So this is definitely not a celebrity who ruined her face with plastic surgery. She actually has probably made millions of dollars off of this plastic surgery.
During an interview with Glamour in 2018, she said, "It makes me happy. And you know, if I want to put my tits on my back, they're mine to do so."
I love it when celebrities are upfront and honest and they have no apologies from getting plastic surgery because honestly, they're all getting work done out there and it's only a handful of them like Cher, like Dolly Parton, who are admitting to it and are proud and they're just announcing it to the world, which I think is a good thing for all of us normal people who may get work done. This helps get rid of that stigma that plastic surgery should be something that you should be ashamed of or that you need to hide from other people.
The actress admits to having a facelift and also Botox to reduce wrinkles and frowning lines.
Yeah, I think she's had more than one facelift. Probably, if I had to guess, maybe 3? Maybe more?
It looks like she's also had a neck lift and an eye operation. She would also have regular dermal fillers, as at her age the skin loses volume and needs to be plumped.
Okay, so in my opinion, Cher's had a lot more than just that. She's also probably had at least one brow lift. She's had both her upper and lower eyelids done, I believe, probably fat injections into her cheeks, and I believe she has an implant in her lower lip. Her lower lip looks like the lower lip of somebody that you may know, Ben Shapiro. Take a look at Ben's lip up here and compare it to Cher's lip right up here. They look the same.
In the number 7 spot is Donatella Versace, the Italian fashion designer and current vice president of the Versace group.
Poor Donatella, she's on, I swear to God, all of these lists of like the worst celebrity plastic surgeries. Now the question is this deserved?
In 2013, during an interview with Sunday's Vogue Festival, she said, "I am not genetically like this. I use tons of cream and take care of my hair and skin." She went on to admit that she's had Botox done on her face, but denies that she has had any other work done besides that.
What? She denies having any plastic surgery? At all? Seriously? Did you look at these pictures? Hey, want to know the ultimate skincare secret? It's retinol. With this stuff, you can say goodbye to fine lines and wrinkles and hello to smooth, glowing skin. Retinol, a form of vitamin A, works to reduce the appearance of aging of your skin. This powerful moisturizer hydrates your skin, leaving it soft and supple. And with regular use, you'll see a noticeable improvement in your skin's texture and tone. Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
At number 6 is Pamela Anderson, the legendary actress and model mostly known for her work in Playboy magazine and on Baywatch. Her looks completely changed after her first breast enlargement surgery and lip injections.
Okay, I really disagree with putting Pam on this list at all, and at number 6, above Michael Jackson and Donatella Versace? Are you kidding me? Pam, I think, still looks great, and so plastic surgery did not ruin her face.
America's holistic plastic surgeon Dr. Anthony Youn did a report of all the surgeries he suspects Pamela has had done based on his professional experience and knowledge. Throughout the report, he states that he thinks she's had some fillers injected into her cheeks, laser treatments done to her skin, Botox injections, and some fillers or fat transfers within the skin on her face.
I think that guy knows what he's talking about. I would agree with all of these procedures that he thinks that Pam has had done.
Halfway through at number 5 is Carrot Top, an American stand-up comedian and actor whose original name is actually Scott Thompson. Over the years, rumors have spread that he has undergone a number of different plastic surgery operations.
Now number 5 is Carrot Top. Now I'll tell you, many years ago I was out in Las Vegas eating at a restaurant, and Carrot Top actually showed up and ate at a table like literally 2 tables down from me. And I tell you, his appearance was very attention grabbing. He walked into that restaurant and everybody turned their head and looked at him. And the reason why I think is because he's got this huge mane of curly orange hair, he's got fairly pale skin, and he is built like a brick house. So has he had plastic surgery though?
During an interview back in 2013, he was asked about what he thought on the rumors. His response was, "People think I've had plastic surgery. No, it just takes a lot of makeup to make me look good."
Makeup? How do you use makeup to make your eyebrows go like this? I think it's more than just makeup. Let's see what their expert says.
According to plastic surgeon Dr. Youn,
That's Youn, not Un.
he says he definitely has had some work done. He says yielding an excessively arched brow and a smooth face is the result of laser treatment. He's looking more and more like a muscle-bound cartoon character.
I said that? I said that a long time ago. Now, I'm not Carrot Top's doctor. When I mentioned that before, it was my opinion, not saying that he's definitely had these procedures done. But to me, when you've got a brow that is arched so aggressively like that, I do think that often is a telltale sign of Botox. You may have seen this in some other celebrities like Nicole Kidman. And the reason why this happens is that Botox, when it's injected into the forehead, can cause the frontalis muscles to work differently. And in situations where somebody already has an arch to their eyebrow, it can cause that arch to become over-exaggerated, making the person look like Carrot Top.
Here we are at number 4 with Janice Dickinson. She has been referred to as the world's first supermodel.
So I actually kind of agree with Janice being on this list, although I don't think I'd put her up this high on the list, maybe down towards 9 or 10. Now, I used to see Janice Dickinson on reality shows, and then she seemed to disappear for several years, and now I've seen her reemerge on TikTok of all places, and I feel kind of bad for her because every time she posts a video, there's just all these comments that just say, "Caitlyn Jenner, is that you?" And obviously she's not Caitlyn, she's Janice. But do you see the resemblance? Here's Janice, and here's Caitlyn. Do you think they look alike?
Janice opens up and explains that she managed to avoid drugs entirely for the first 5 years of her career, but finally gave into temptation following a bad breakup. The model spent the next couple of decades filling her body with drugs and also plastic surgery.
Now, I really do hand it to Janice in that she's been very upfront with the plastic surgery that she's had done, and sometimes when she's not been happy with the plastic surgery. She actually wrote a memoir where she really just chronicled every single operation that she's had done, which I think for me as a plastic surgeon really is a breath of fresh air coming from a big celebrity like Janice.
She has never been shy to admit that she has had breast implants, lip injections, and other work done on her face. She even appeared on the hit show Botched to get her breast implants fixed, and the doctors were concerned on how she would handle the medications with her past drug addiction.
I did see that episode, and if I remember right, she was quite the bear after surgery. Was not the ideal patient. She was quite demanding, which I guess what else would you expect from the world's first supermodel?
At number 3 we have Tara Reid. She had a naturally beautiful look, but over the years she has gone through some awful plastic surgery experiences.
Oh, Tara Reid, what a beautiful young woman. Now you may remember many years ago that she was on the red carpet and had kind of a red carpet snafu where part of her areola showed. And you can see a scar from what looked like a breast lift. In addition to that, photos of her emerged around that same time of her abdomen looking unusual and kind of scarred up, like in that picture that you just saw on this video.
In 2006, she had a procedure done called liposculpting, which went horribly wrong and actually botched her stomach.
Okay, so liposculpting, is that the same as liposuction? It is. There's some doctors who call it liposculpting to try to make it sound fancier, but it's the same thing. People are just trying to make themselves sound all fancy and artistic and crap. Now, the reason why I believe that Tara Reid had issues after her liposuction of her abdomen is because, I mean, look at that before photo of her. She is tiny. There's very little fat on her abdomen. She is not a liposuction candidate. you can be too skinny for liposuction, and if you are that thin and somebody tries to liposuction you, then you can get visible scar tissue afterwards, which is what appears that happened to her.
She also explained that her breast implants were botched by the same doctor, which left her with deformed nipples. She later had both procedures reversed, but it wasn't able to fully fix the issues.
So she was actually treated by one of my really good friends, Dr. Steven Spalak in Beverly Hills. Dr. Spalak and I did our training together, and I left Beverly Hills in 2004. He actually treated Tara Reid in 2006, not shortly after I had left. Obviously, if I had stayed in town, Tara would have picked me to be her surgeon, and maybe her life would be different now. Probably not.
In spot number 2 is Jocelyn Wildenstein. Honestly, I'm not totally sure what she's famous for.
She's famous for being the Lion Woman of New York.
Despite what everyone else says about her, she claims that she hasn't had that much surgery and blames her Swiss background for her high cheekbones and cat eyes.
So she's not had plastic surgery, and this is because she's Swiss? I've met some Swiss people in my lifetime, and they don't look like Jocelyn.
She pulled out photographs from when she was in her teen and her early 20s because she wanted to show the interviewer that she has always had these features.
Okay, so I can see the resemblance between the two photos. I'm sure you can see it too, but I mean, is there any chance that she's not had any plastic surgery, that she looks this way naturally? I mean, if she says so. Now, if Jocelyn is number 2, I can't imagine who's number 1 on this list. Let's find out.
Taking our number 1 spot is Heidi Montag. She became famous from the MTV hit show The Hills, where she was Lauren Conrad's best friend. She shocked the world when she had 10 plastic surgeries done in just 24 hours. Not procedures, surgeries. It was a brutal process, and she barely made it out alive, literally.
This was huge news back maybe 15 years ago when she underwent all of these operations at one time, and it was publicized to the ends of the earth. And I really think that Heidi having these operations really was a big publicity stunt. And unfortunately, you know, this is somebody's body here, this is somebody's health, and to put it at risk for essentially a publicity stunt, I mean, it's really, really sad and unfortunate.
A mini brow lift, Botox in the forehead and frown area, a nose job revision, a chin reduction, fat injections in the cheeks, nasolabial folds and lips, neck liposuction, the ears pinned back, a breast augmentation revision increased to a size F, liposuction on the waist, hips, and inner and outer thighs, and buttock augmentation.
Performing this many operations on a young woman, a beautiful young woman, is honestly, it's just wrong. Her plastic surgeon should have said no to her and should have not performed all these procedures on her all at one time. Now, a sad note to this story, as sad as her story is, her surgeon actually died in an accident, a tragic accident, not long after these operations. His name was Dr. Frank Ryan, and he was one of the kind of big Beverly Hills plastic surgeons at that time. So, you know, rest in peace, but this is not something that I myself would have done on such a young woman. I mean, so much surgery.
Turns out her heart actually stopped for a minute and she was technically dead on the operation table.
I never heard this part of it, that she actually died on the operating room table. I mean, I don't know when this happened, if it happened before they finished the operation. Did they do more surgeries after this? Yeah, just not good at all.
She continued to say that the risk wasn't worth it and that she is done. I quote, "risking my own life for vanity." She does regret her decision and calls it a huge mistake, but says it forced her to grow as a person.
Well, I'm happy for Heidi that she's found herself in a better place, that she doesn't feel the need to undergo all these cosmetic surgeries to make herself feel better or as essentially a publicity stunt. Now, recently I shared a video where I listed some of the worst celebrity plastic surgery trends, and these are things that celebrities are doing that they definitely should not do. Check it out right up here, and remember, eat real food, use clean skincare, and auto-juvenate before you operate.
One way to get.
Like a job?
Now, McMillan Industries has a new leader.